how does the stroke in itself affect or cause spasticity?
So spasticity happens after the stroke because there's also an injury to those centers between the brain and the spine that control voluntary movement.
Right.
So that's basically what happens.
So we actually have a list here of different types of spasticity. So doctor, will you please walk us through some of these? A tight fist being the first one.
Yes, so patients with spasticity tend to change position of the joints with different postures in the arm and the leg that was affected. So they tend to have a tight fist, so it's difficult for them to open and sometimes grab objects. Then the elbow usually goes into a flex position as well. It's difficult for them to extend the elbow. And the arm is usually pressed against the chest because they have tightness all the way up to the shoulder also. Then going or moving into the lower extremity or the leg, the knee can be so stiff that it's difficult for them to bend or extend their knee. Mm-hmm. And the foot usually goes down, or what we call a foot drop.
Okay.
In patients, just because position due to the increased tone in certain muscles.
Now there's something I do want to go back to, and it's what's called TIA, transient ischemic attack. Now how is that different from an ischemic or hemorrhagic stroke?
So the transient ischemic attack is usually an event, it's like a stroke,
okay,
that usually resolves in the first 24 hours. So that's the difference. After those 24 hours, most patients have resolved 100% of the symptoms that they initially presented.
Okay.